welcome. Hi, I'm Jill Gilbert, and we're in the Digital Health Live studio, live from CES. And I'm really pleased to have in our booth today Dr. David Rhew, the Chief Medical of Samsung. Thank you for coming.
Thank you, Jill. It's a pleasure to be here.
So tell me a little bit, because I know Samsung's been doing a lot in digital health, wellness, healthcare. Tell me a little bit about what Samsung brought to the show this year.
Well, you know, as you have seen in some of the presentations, we have a lot of new technologies. We've got some interesting bots that I think have gotten a lot of attention. But generally speaking, our emphasis has been around how digital tools can be used to improve health outcomes, to transform the patient and consumer experience. And a large part of that's been going on for the past year. I've been on a couple of panels recently where we talked a bit about some of the advancements really around how it's transforming the lives of individuals, specifically with those with disabilities.
That's great. So tell me, actually, I'm really interested in the disability side. Tell me a little bit about that.
Yeah. So if you think about disabilities due to age, illness, injury, there are many things that we have found that could potentially be addressed through the use of digital tools. In fact, the 2019 CES Innovation winner is a Samsung partner called Iris Vision. And what they did is they took a VR headset and customized it to help those with macular degeneration basically see. So the way that you can think about this is macular degeneration is the condition that impacts the eye. It's specifically in the area that is responsible for acuity of vision. But what most people don't realize is there's another part of the eye that actually has similar type of functionality. But since we don't use it regularly, we don't know where it is. It's hard to be able to leverage that. The technology allows us to be able to find it, magnify it, and in remarkable studies we've seen at Johns Hopkins and other sites, restore vision from 2400 to 2030. These are people functionally blind that can now see.
It's like finding the muscle that you're not using enough. That's incredible. Like when you're working out.
Exactly.
That is amazing.
Yeah.
I mean, it must be profound to see people see again, you know?
That is, and then we also have, through some of the research that we've been doing in collaboration with partners and also independent research, we have found that the ability to use some of this technology, for instance, exoskeletons, which was one of the things that we demonstrated here at CES, as well as VR headsets, using this for patients with chronic paraplegia in a study that was published last year at Nature demonstrated that in 12 patients who had chronic paraplegia, we're talking about inability to walk, loss of bowel and bladder, use of this combination restored function. And most recently, the New England Journal of Medicine and a variety of others have demonstrated that implants into the spinal cord allow individuals with spinal cord injury to be able to walk. This was an implant that was done by one of our partners, Medtronic, and we are now working with Medtronic to be able to replace the controller with a Samsung phone. So now, down the road in the future, we're talking about patients using their phone, helping them to be able to recover, function, and essentially do things that they couldn't do in the past.
Fascinating. I actually kind of want to just go check all this stuff out right now. So yesterday, I had the honor to have you part of my program at the Digital Health Summit. You were on stage in front of 600 people with EY. Can you tell me a little bit about that and share with everyone what you guys talked about?
Sure. Well, the name of the the topic was about consumer data and really what was the value and the role of that. And what we're finding is that it's more than just steps. It really is about the fact that we now have an opportunity to be able to pull in multiple different types of data, be able to understand what it means, and that it's allowing us to be able to think about ways that we can be more proactive. So one of the big initiatives that we at Samsung are very proud to be a part of is collaborating with some of the organizations that are setting the standards, such as CMS, ONC, HHS, to define interoperability standards that can be used to bring in data from electronic health records, claims data, and others into the smartphone, on the cloud. Now imagine this. You have the ability down the road to be able to pull the data, go anywhere, and be able to communicate, and now potentially combine that with some of the wearables data and other things, draw insights from it.
It really gives you this beautiful, holistic picture of yourself, and we've been talking about big data and data for years at the show, but now sort of bringing it into not just pieces of numbers, but sort of helping people realize what it means.
Absolutely. I mean, it's going to start first with just the ability to be portable, have accessible, portable data, but then it really is going to very quickly move to understanding the data, making sense of it, and then creating actionable insights. And once we do that, that will allow us to be able to help consumers to be able to do what needs to be done. And then we're going to have to marry that with all the things that we know that help motivate the social and other types of prompts.
Wow, thank you so much for stopping by today. It's a privilege to be able to interview on stage here. I want to thank everyone for tuning in. And this is Jill Gilbert signing off from the Digital Health Live studio at CES.